Well, welcome everybody, and thank you for tuning in to this important discussion on vaccines as COVID-19 vaccines become available in the United States and now increasingly around the world as well. I'm Katty Kay. I am the anchor for BBC World News America, and I'll be moderating this conversation. I am grateful and privileged to be joined by an esteemed group of healthcare experts. They know firsthand how important it is that people have access to the latest and most accurate information as this vaccine starts to roll out across the country. It includes everything from how safe is it, to how efficacious is it being distributed to the important people that it needs to be distributed to, particularly ensuring that communities of color receive the vaccine as they have been disproportionately affected by the coronavirus. So all of those questions we will answer. We've taken some of your questions too. They will be answered as well. Let me introduce my guests, starting with Dr. Leon McDougall, President of the National Medical Association. Leon, thank you for joining us. Dr. Jewel Mullen, she's Associate Dean for Health Equity at the University of Texas Dell Medical School. Jewel, thank you so much for being here with us today. Elizabeth Subcheck is Director of Strategic Alliances at the Gerontological, I knew I would mess that up, Gerontological Society of America. Elizabeth, thank you as well for being here. And Susan Winkler is the CEO of the Reagan-Udall Foundation for the Food and Drug Administration. Susan, thank you for giving us your time today. And Professor Carlos Del Rio is also with us. Carlos, we spoke as well briefly before this conversation, so I'm looking forward to hearing what you have to say. You have so much information on the latest on vaccines as well. Let me start with kind of the newsy issues of where we are right now and ask each of you, as this vaccine starts to be rolled out across the United States, in the UK and in Europe, what has surprised you most about this process? And Jewel, maybe I could start with you.
I've actually been surprised, and happily so, about the enthusiasm for the vaccine. Because as much as we talk about our concerns that some people won't want to get it right away, I think some of that actually reflects that they're just watching and waiting what's going to happen. But in general, I've been talking to people who are so eager to get it, and the question becomes, when is my turn? And that means we have a lot to do to keep people on board until it is their turn.
That's so interesting, because we're also going to talk about people's skepticism and vaccine skepticism during the course of this conversation, but it's good to hear that you're hearing that people are enthusiastic. Susan, what surprised you?
I've been surprised and impressed by the collaboration. So the working together of industry, of scientists in academia, working with the FDA and with other entities in government, that willingness to share information so that everyone can move more quickly by learning from what others have done.
And has that been global as well, Susan, or are you talking about just scientists in the US?
So I would say scientists in the US and global as well, that we're just sharing information in an unusual way, and one that I hope will continue after the pandemic, that will understand that sharing scientific understanding helps us all move together more quickly.
I have heard that is true, and I know that this is a fantastically competitive field, so it has struck some people as one of the high points of this year that people have shared as much as they have. Leon.
Yes, great question. I would say I'm surprised about how visionary Dr. Martin Luther King Jr. was in his book, Where Do We Go From Here, Chaos or Community? And he spoke to the pillars of the Black community, that being the Black church, Black press, Black fraternities and sororities, and Black professional organizations, and how in my role as president of the National Medical Association, I'm working with all of those groups to speak to this time. So that's my comment.
Well, a lot has been said, and I agree. I think in a year that we have had a lot of failures in addressing this pandemic, I think a success has been this scientific collaboration and the way in which it's not just in vaccines, it's in many other things, but the way scientists across the world And scientists, government, industry, and community have worked together. I mean, the way that this clinical trials to approve the vaccine have been able to enroll so quickly, it's because there was a lot of interest in the community, and there was a lot of support, and there was a lot of things were facilitated. So I think we've learned a lot about how to better do clinical trials. I can tell you, those of us that have been doing HIV research for a while are not surprised. We are where we are in HIV care and in treatment for HIV because of the partnership of industry, community, scientists, governments, and particularly the people living with HIV and the people at risk of HIV. So I hope that this influences the way we do research in general, not just in these circumstances.
Yeah, a lot of focus has been put this year on frontline healthcare workers, quite correctly. But the people who have been working on these vaccines have been working around the clock as well this year. And they are going to be desperate for a break at some point, but we are grateful that they've been working as hard and as effectively as they have been. Elizabeth, a word on what surprised you.
I've been really pleasantly surprised by the high amount of interest among the public in the process of developing a vaccine. I think it's one of the pillars to building confidence in vaccines in general, and having people understand how much vaccines go through in the development process when they're reviewed for licensure and recommendation, when they go through manufacturing. I think all of those pieces, and having a public that understands those pieces, is really critical to building confidence for COVID vaccine as well as all of the other vaccines that we have. And so seeing the interest in the process, as someone who's studied the process for a long time, is really pleasantly surprising. It's not something that's read about for fun, but it really is a critical component just to have people understand.
Let me ask you a little bit more about that, because I want to get into the different vaccines that are out there, those that have been approved, those that are still waiting for approval, and what the differences are. My understanding, and it's interesting that you point to the openness, Elizabeth, is that there have been some questions here in the US about the openness of the process of a vaccine that is being developed by Oxford University and AstraZeneca. Are you saying that you are satisfied that enough information from all of the vaccines that are out there has been put out there that people can make an informed decision?
That's a great question. So I think we've seen a lot of results coming through in press releases this time around. That's not an ideal process, I think. But as they've gone through these phase 3 trials and we've had more time to start publishing the results, we're starting to see those in peer-reviewed journals, which I think is a more ideal process. There's really a tough balance here between conducting the research, sharing the research, and making sure that people have access to the details as they're coming out. So is it ideal? I don't know that anything in this process has been ideal, but we have certainly started to get to that point of more transparency with more data.
Susan, we now have, I think I'm right, we have just 2 vaccines that have been approved in the US, the Pfizer vaccine and the Moderna vaccine.
Not yet. The Moderna vaccine has
just
not
have one.
No, the Moderna vaccine is not there yet, but it's almost there, correct?
Right. It's
in process.
Yeah.
It's in the process of being approved.
Let's say by Friday.
Okay.
Well, and if I may,
yes.
What I was going to build on what Elizabeth had said, because one of the ways that we're getting information and sharing information is that part of FDA's process is to have an advisory committee, which is where the scientific advisors dig into the data and look at it and evaluate it and test it and ask questions. And that meeting is something that anyone can watch, connecting into YouTube, and say, well, what is that expert asking, and what is their question, and what do we know? So we're certainly seeing more information. I think it's great that you can watch that advisory committee process, but we have one vaccine authorized for use in the United States, discussion of the second one this week, and then an FDA regulatory action expected shortly after that discussion.
And Susan, without giving us any news that we shouldn't be privy to yet, or breaking any confidentialities from the point of view of the FDA, do you think we will end up with 3 or 4 vaccines being approved within the next few weeks? Is that what you expect will happen?
So certainly there's a number of promising vaccine candidates, and it's a question of the timing and having the information available. I think certainly 2 and more will follow, but each will be evaluated rigorously and independently and individually. So we do need to look at this as a process of what do we know about each vaccine candidate, and the FDA and the advisory committees will be looking at each one to make sure that we are as confident as we need to be, and we know what we need to know about each of those vaccines.
And this issue of safety is so important because, of course, it is the safety factor that is deterring some people from wanting to take the vaccine. Before we get to the pickup of the vaccine and who's taking it and who might take it and who has concerns about taking it, I just wanted to get an outline of what the differences are between the vaccines that we have approved and those that are coming down the pipeline, and whether people should be paying any attention to any significant differences. I don't know who wants to jump on. Carlos, maybe this is your field. Is there, between the Pfizer vaccine, the Moderna vaccine, the AstraZeneca vaccine, what are the big differences that people might want to be aware of?
Well, let me just start by saying and reinforcing what Susan said. I think what we've learned in this whole process is what a critical job the FDA plays. And I would again emphasize that the way in which FDA commissioner and others have sort of withstood political pressure. This is not about doing politics, it's about doing science. And the way the FDA has worked, in my mind, just should give everybody assurance that things are going the right way. I mean, we all as Americans trust and rely on the FDA, and having a strong FDA that's doing its job, to me, just makes me feel very proud of having such organization doing the review, doing the approvals. I mean, they're rigorous. They're looking about every single aspect, not only efficacy, but safety of the vaccines. And I have full confidence that the process is working, and everybody needs to be assured of that. The vaccines are different. And I think to me, the most important thing is that they're all coming in different technologies: the mRNA technology, the vector technology, the subunit technology, but particularly in the adenovirus vector technology and the mRNA subunit technology, these are new technologies that we've yet to have a vaccine in clinical use in any of these technologies. And that, to me, again, shows you how many years of research has gotten us there. And if it hadn't been for years of research that started way before coronavirus, we would not have the mRNA technology to be able to do this. So I think we're building on many years of research. Supporting basic research matters. But the second thing is, I think this is going to transform other vaccines into the future. And I can see this leading to a big area of vaccines beyond coronavirus, and even vaccines for cancer. So I do see this as being, I mean, this is a little bit like, again, I go back to my origins in HIV research. A lot of the things, I mean, the reason we have PCR testing for coronavirus is because we invested in the infrastructure to do PCR testing for HIV. If we hadn't done the HIV testing for HIV and invested in that infrastructure to do HIV PCR testing for viral loads, we would have not been able to confront the testing for coronavirus. So how this disease is and how that research works together matters. And in my mind, the different coronavirus vaccines, what really makes it important is that I think this is going to there'll be an explosion of new technologies and better vaccines for other diseases, including, quite frankly, I think influenza. I think we're going to really revolutionize the field of vaccinology as a result of these efforts right now around coronavirus.
And a lot of people have pointed to the fact that these vaccines, the Pfizer vaccine and the Moderna one, are so efficacious. Jewel, jump in, and can I add a question for you, Jewel, because I wanted to come to you on the vaccine itself, and almost to describe in layman's terms. I'm not a doctor. Tell me how it works, because we've got a lot of questions coming in around the issue of, for example, does the vaccine give you a mild case of COVID? Another one, how is that not the same as getting infected?
The point I wanted to make will lead right into that, because I wanted to add this other dimension about vaccines in general, going all the way back to how Elizabeth responded to your question about this coronavirus vaccine. Because I've been on this earth for several decades, and I can't remember any time when we've ever had this much information about a vaccines being developed. Still, vaccines are considered one of the top public health achievements of the 20th century. One day, I hope we talk about the coronavirus vaccine like we talk about the influenza vaccine and the measles vaccine and others, with maybe more people willing to take all of them than we have right now. But if we remember that, then maybe for as unique as this circumstance is, we'll also be able to say, and this is another vaccine. And then we can also start to address some of the concerns that people have about this vaccine, like with others. If you take the coronavirus vaccine, does it give you the coronavirus? No. And so as a doctor, I've had to address those issues with my patients on the years when they say, no, the flu shot always gives me the flu. Flu shots don't cause the flu. And that's where these kinds of conversations are so important, because they also give us a chance to say, if you feel a little achy or feverish or have a sore arm or something, then if you're wondering whether or not the shot you got is working, maybe that's a sign that it's doing what it's doing inside your body, which is to signal to the proteins in your body that help you develop protection to start working. And that's getting ready to start. And that's not the scary part, as long as you have somebody to check in with to say, is this normal? And so I hope I'm answering that question, Kathy.
I now feel like a complete dummy, because I'm a reasonably educated, reasonably intelligent 55-year-old woman. And yet I have always assumed that when I got a vaccine, the reason it worked was because I was getting a little bit of whatever it was that was in that syringe. I'm wrong.
Well, I didn't hear what Carlos said.
I just said depends on the vaccine. Some vaccines are live viruses, some vaccines are subunits.
Right. So in general, and so that's part of the answer. And that's why there's not a one size fits all answer.
But I don't need to feel quite as stupid as I was.
There's nothing stupid about you. And I always tell people there's no stupid question. And that's part of what we have to do right now, is take every question as it comes. Because if we act, yes, go on.
Leon, can I get you into the conversation too, from a bit more about the vaccine and how it works? There are a lot of questions about whether the vaccine confers immunity from the coronavirus, or does it just stop you developing severe symptoms of the coronavirus? Do we know which it is?
So, good question. So the messenger RNA enters the cell and instructs the cell to make a protein that mimics the spike protein, and that warns the body, and then the body produces antibodies to that mimicked protein, so that when one is exposed to the live, real, somebody coughed on you coronavirus, then we're able to marshal a defense to fight off the coronavirus. And the symptoms of achiness and a sore arm and such that one may experience several days after getting the injection is part of that process of building one's defense network. And very similar to what we experience sometimes with the influenza vaccination. So I'm a family physician in Columbus, Ohio. I have this conversation all the time, and in regards, and one of the things I say, and what I've said with this vaccine for COVID, is that I will receive the vaccine. And with the influenza vaccine, I share a story. The 1 year, for some reason, I got so busy, I delayed getting the flu shot. And before I could get the flu shot, I got the flu. And Caddy, that's the sickest I've been in a long time. So I just share that story, personal anecdote, and being in the community, being a trusted messenger, that goes a long way.
On the science of this, we've got a question from Maddie from New York City.
I'm curious what adverse reactions have happened from the vaccine. In addition, what are the long-term risks of being vaccinated?
So I'll speak to the long-term piece and then maybe defer to Dr. Del Rio or McDougall or Mullen on the short term. But the long term, that's a piece that we don't know. We don't know much about coronavirus or COVID-19 long term. And so we simply, that's one part of the vaccine review and authorization process that we can't shorten. We just don't know long term, but we will be monitoring. It's one of the things that after FDA authorizes a vaccine, that we'll be continuing to monitor for any long-term effects. We aren't seeing any signals that tell us we should be really concerned about something, but regardless, there will be monitoring to make sure that we find and see anything that might emerge longer term. But I might turn, yep.
Just brief, there were two and we should clear this up, there were two healthcare workers in the UK who did have an adverse reaction. Does somebody know about what happened in the UK with the two healthcare workers? Because I've heard that being spun into all sorts of theories about.
Well, let's put it this way. Again, when we do clinical trials in vaccines, when you're bringing in totally healthy volunteers into studies, because this is very different. As somebody who does clinical research in both treatment and vaccines, when I do treatment, is somebody who needs a therapy, right? So they're benefiting. But when you're doing vaccine, these people are total volunteers. They're there. So the safety of the volunteer is so critically important. And I tell people that as a vaccine researcher, while I care about efficacy, I really care about safety. And every time we're doing a study, the moment there's any signal that makes you question that there may be a safety, you put a pause, you halt, you look at it, you have the DSMB look at the problems. That's what happened with the UK. There was something that happened and somebody that says, let's stop, let's look at it. And then if everything looks okay, we'll restart the study. And that's how science works. That's what it was supposed to happen. And again, I think we need to be very clear in how we communicate that the vaccine from a safety standpoint, the trials so far look incredibly safe. The data in the short term looks incredibly safe. And the data in the long term is likely going to be very safe, but it's going to be very difficult to distinguish what happens in life versus what are just side effects, right? And that may take billions of people, millions being vaccinated before we know that.
But that's really important, though, as we address things such as if people read, a couple of people had very severe reactions that are called anaphylaxis, for example.
Those were the workers in the UK.
Yes, because then what people will say is, some people will say, well, then should I personally think I'm at higher risk? So just what we observed this week with questions coming up, if you have severe allergies, should you get the vaccine? And then CDC's coming out and saying it's still okay for people with allergies to get the vaccine, reflects the continuous learning that we do along the way to help to put everything into context for big groups of people and for individuals.
Leon.
And that's part of that risk-benefit assessment, and knowing that these two people had a history of severe allergies requiring prescription of an EpiPen. So that, I think, would also involve a discussion with their allergist in regards to ongoing treatment prevention with the vaccine. So, and the fact that this information is known is actually a success. That's what we call transparency. And to have this national and actually global discussion, I think, is very helpful.
I want to get more around vaccine hesitancy just in a second, but there are a lot more questions around the vaccine itself and the process. So let's get to some of those. Susan, there is a question here. I've had COVID and tested positive for antibodies. Do I need to get the vaccine? Sorry, not Susan. Let me take that to Elizabeth. I'm mixing Susan and Elizabeth up on my screen. Elizabeth.
That's quite all right. So I believe the recommendations from the CDC are that immunity from actual infection is, they haven't seen any reinfection within 90 days. And so the recommendation from CDC is to, if you'd like, wait until the end of that 90-day period or close to the end of that 90-day period. But if you have been infected and do have antibodies, you do still have the option to get the vaccine, according to CDC.
Okay, Elizabeth, take this one too. COVID isn't a big deal for most people. Why should anyone who isn't old or sick get vaccinated?
Oh, that's a great question. So I think, first of all, we don't know who's going to have the long-term effects. We have no idea to be able to predict if a healthy 40-year-old is going to be one of these so-called long haulers. We have no idea if a 90-year-old is going to recover with no long-term effects. There's not a good way to predict that. And so because of that, I think it's important for people to have individual protection to be able to prevent what may be a severe case. The second piece that's important to get the vaccine, I think, is that we have this herd immunity. And so let's say I'm exposed, I don't have any symptoms, I go visit my 96-year-old grandmother and I take it to her. And she has a really severe case, she may die. I'm in bad graces with my family from here until forever. So we have this ability to protect the people that we're around. We have this ability to get our kids back in school face to face, which I think a lot of us are really eager to do. And so the vaccine gives us the opportunity to have this community immunity built up around us. And so even if a case comes in, it's stopped very quickly, and we're able to get back to our pre-pandemic lives in a much more effective way. I think the bottom line message here is that the vaccine is our way out of this pandemic. And we do that by protecting ourselves individually and protecting the people that are in the community around us.
Hallelujah on getting kids back to the school, because my 14-year-old daughter is next door in her bedroom studying, perhaps,
Yes.
but you know, I'm highly skeptical about how effective it actually is. I want to address something there that you have raised, Susan, and maybe Leon, you could pick up on this. Is there therefore a big difference in the effectiveness overall of these vaccines if they stop us from actually getting infected, as opposed to just stop us from getting the symptoms? Because I'm assuming that if they stop us from getting infected at all, that would mean that then I can't infect other people. It would mean that I could travel to the UK to see my family without having to spend 10 days in quarantine. I guess I wouldn't have to wear a mask so much. And do we know whether it's just that we're not getting symptoms or whether we're not getting infected?
Well, that's a good question. And so the purpose of most vaccines are to provide self-protection from actually developing the disease. And the disease usually has bad effects that could lead to death or long-term illness. For example, I think going back to the prior question, a person asked, well, most of the people I know, I don't know anybody, or I keep hearing that this disease isn't affecting a lot of people. I think the question itself is a bit maybe misinformed, because a lot of people are being infected. And I practice on the Near East Side of Columbus, Ohio. I've seen firsthand. I have a Black male patient, former collegiate athlete, about 35 years of age. He was diagnosed, and an essential worker, diagnosed with COVID-19. He was in the ICU for 4 weeks. He was in the hospital for 6 weeks. He was placed on dialysis, and thank God he's now coming off of dialysis. I've seen members really of my family practice panel suffer from COVID-19. So, and then when you look at the death rate in the Black community, nearly 3 times that of the European American community, the hospitalization rate, like 4.7 times, almost 5 times the European American community, and diagnosis about 1.6 times. I know I'm giving a lot of numbers here. I'm sorry about that. This is a national crisis, and it's affecting all of us.
Well, and some more than others, clearly. This video question has come in from Dr. Leondra Clark Harvey. She's a psychologist in Sacramento, California.
Hi, I'm Dr. Leondra Clark Harvey, a psychologist in Sacramento, California. And as we discuss the rollout of the vaccine and prioritizing communities, I'm wondering what thought has gone into how to market to vulnerable communities, particularly those that represent racially and ethnically diverse populations. We know that they've experienced a history of stigma, a history of mistrust due to the way that these communities have been targeted by the medical community at times historically. So what is the plan for marketing to these populations and partnering with communities in order to make sure that people get the help that they need during this pandemic?
Jewel, do you want to take that?
There's across a number of communities working through medical societies, working through organizations such as where I am in Austin, Texas, working, the Black Physicians Association or associations of physicians of different racial and ethnic minorities who are much more in connection with those communities, who are taking it upon themselves to do that kind of outreach. You hear a lot of talk about people saying the messages need to come from people who look like the people most affected. What I would say is we're playing catch up in communicating and outreach important messages that people have been saying should have started a year ago. But rather than saying, why didn't they? Part of even what you're hearing Dr. McDougall say is the full court press to get that information out and to not just rely on us doctors to do it. What I say is get real people to spread the messages instead. Sorry, Dr. McDougall, I know you're a real person. But I think that's really important. My former public health colleagues are also reminding us that state and local public health departments are probably $8 billion short in what they need for this vaccination effort. And part of that is for communication. And not just because I'm talking to you, what I would say is I'm relying on all of my media colleagues who are trusted messengers as well to help us keep that accurate information getting out into all kinds of networks.
So there's another, a message has come in on the same lines.
Kathy,
yeah.
I would like to tag team on that question and question or answer by Dr. Mullen. So the Black Coalition Against COVID has come together, and it's a coalition involving the historically Black medical schools, Howard University, Morehouse School of Medicine, Meharry in Nashville, Charles Drew in Los Angeles, along with the Black Nurses Association, the National Medical Association, the Montague Cobb Health Institute, the National Urban League, and blackdoctor.org. We've actually created a love letter to Black America, speaking to this time and our devotion and commitment to the Black community to help guide us through this global pandemic that's so adversely affecting the Black community. And actually, there is a website one could access, www.blackcoalitionagainstcovid.org/love letter, and on Twitter @BC Against COVID. And we've convened town hall meetings. The first two garnered over 240,000 views. We actually have another town hall speaking to the distribution plan on Thursday evening. And I've been engaged with national clergy leadership because Black church and leaders in the Black clergy community, they're getting these same questions from their congregations. So we're setting up venues to meet virtually, to speak to those leaders so we can all advance and mitigate COVID-19?
Because we have a confluence of events, right, where you have, for understandable historical reasons, a high level of vaccine suspicion amongst African-American communities in the country, and African-American communities being disproportionately affected by this pandemic. So we've got a kind of double whammy there that needs a specific communication program. Timika from Charlotte, North Carolina, and I want to raise this question because I think it gets to why it needs to be addressed. Black people are usually the last to get access to good medical care. But with the vaccine, people are encouraging Black people to get it. Am I right to be suspicious? If you were, Jewel, if you had Timika sitting in your surgery, in your office, is there, and I know there are a lot of anti-vaxxers and a lot of vaccine suspicion, and they all come from different, and what the message that you have for somebody in New York City is going to be different from the message you have for, a Hispanic person in Idaho to an African-American talking to you in Texas. What would you say to Timika in Charlotte, North Carolina, when she asked you, am I right to be suspicious?
I think everybody has a right and responsibility to know history, and then also to take understanding of that history and put it in the context of what's happening in the present. And if you can do that with people who can give you the information that you need, starting with answering the questions you have, not the ones that they want to answer for you, then that can help you see that your suspicion does not need to be what you think it ought to. There's this other piece of that, though, that goes to ongoing historical inequity and unfairness. And that is, we will make a big mistake, and this is something to hold all of us medical people accountable for, is if we tell people we really believe this is helpful for you, and then they don't have access to it. So all of this communication must be coupled with the ability to actually get the vaccine in a non-threatening way and not be told it's going to cost you money, because then that mixed message adds another chapter in a bad history.
I want to play a video from Sarah, who has sent us this from New Hampshire.
Hi, I'm Sarah Lutat from New Hampshire, and I have a question for the panel. I work with the homeless population in inner city Manchester, and I just wanted to know where in terms the homeless would fall in terms of priority of receiving the vaccine, and if communities that are hardest hit, if they're going to receive more of the vaccine.
Oh, that's a great question. So from the sort of tiering that I've seen, homeless people are not specifically called out. However, if they are living in a congregate setting, in a homeless shelter, for example, they would be higher up on the list because of the risks of living in that congregate setting. If they are older, they would fall in with that next tier of older adults who would be getting the vaccine. I think there's certainly higher risks that the homeless people are at. There's going to be a lot of, I guess, sort of mushiness, if you will, as we start getting past this first phase of healthcare workers and long-term care staff and residents. The states
who should have priority.
Right. So the states have developed their plans for how they're going to deliver, who they're going to deliver to, and what tiering. In some populations, for example, people who are incarcerated are higher up on the list, and in some they're further down. And so the states have really taken the lead to develop the plans for how they're going to implement this tiering process. They have the guidance of CDC, they have the guidance of the national academies, but it's really up to the state to identify what their population is, what the risk in their population is, and then deliver the vaccine in a way that meets with those local and state priorities.
Susan, we have all seen the kind of, well, those of us who are slightly masochistic this year have watched Contagion. And the kind of the sci-fi, the thriller movies about this pandemic. I don't know why I put myself through that experience, but anyway, one evening we decided to, my husband and I. And the moment where things actually got super stressful in the movie was when the vaccine came out, but there weren't enough doses. And so the triage process of deciding who gets it when it caused a lot of social unrest. Are you confident that, given that this is going to be decided on a state-by-state basis, that the process will roll out? So far, in these very early days in the UK and here, it's been smooth. Are you confident that it's going to carry on being smooth and peaceful?
I think overall it will be smooth. There are going to be hiccups. Something will happen, but I think we can look to the strength of the collaboration that we had in developing the science and in the regulatory approval, and say we have every reason to believe that we'll continue to have that collaboration to get us through the distribution components. But it's also, something important for us to say, it's helpful to know where you fit in the priority listing. And so when it's available to you and it's kind of your place in line, then that's when I want to be able to get a vaccine. So I would say we seem to be on a good path. I think we will continue on that path, but it's very much so a collaboration of national, state, and communities in getting the vaccine, out of vials and into needles and into arms where it will make a difference.
In the UK, the decision was made to prioritize people living in nursing homes and their carers and people over the age of 80. And so it struck me when I was reporting on this the other day, the early pictures we saw of people being vaccinated in the UK on the first day were all old people, or nearly all old people. Here, the decision was made to prioritize healthcare workers. And actually, the pictures were often of young people being vaccinated because they were nurses and doctors. How does and maybe this is for you as well, Susan, how does a society make that decision who should be the priority, whether it should be healthcare workers, i.e. protecting the health system, or whether it should be old people preventing deaths?
Well, and so we look to our scientific and public health experts to say, what supply do we have? Where will it provide the greatest advantage? And then staging that access. Nursing home residents in the United States are prioritized. They're in that kind of, they're right up at the top, but I think we happen to have healthcare workers who were available and first, but the nursing home residents are right afterwards. But it's a conversation, and then making sure that when we have a good plan, which we've got from the CDC and from other agencies about how it should be deployed, that we implement that.
There's Betsy has sent us in a question on social media at Betsy Cheever. If you're trying to debunk the anti-vaxxers' many conspiracy theories, what resources should you share? I have a sister who's sending me lots of emails with links to misinformation, and I'd like to redirect her to quality information. This is such a great, the conspiracy theories I have heard amongst people I know. I'm going to get a microchip in my arm if I get the vaccination. 3 people died in the UK in the first day of rollout. And the vaccination is not safe. We're just being told it's safe so that we stop complaining about the coronavirus. And that is from people I met, hairdressers, that kind of thing, here in Washington, DC. Leon, is there a one-stop shop that could help us debunk some of these conspiracy theories, or is it a question of addressing each one head on and trying to find the information that might persuade people, or is it just listening?
Very good question. We entertained that question during our Congressional Black Caucus Foundation event entitled, What Does the Black Community Need to Know About Vaccines? And we spoke specifically to conspiracy theories, and not only conspiracy theories, some alternative treatments are being proposed, such as alpha interferon as a substitute for vaccines developed for COVID-19. And we had an expert panel of infectious disease specialists to speak to that issue. And personally, a Christian brother sent me a video link that was being distributed in the church, and a Muslim brother sent me one that was being directed towards a Muslim audience. So as a health professional, I actually looked at the videos and then really spoke to them. And this is the deal. Those videos are professionally produced. You almost have to have a biomedical science degree to really kind of separate some of that fiction from what really is happening. So I'm not surprised that people are being fooled, because a lot of effort went into producing at least the two that I saw.
Yeah. So, and it is very hard to counter all that is out there on social media. Yes, go ahead.
So if I could, I think the CDC site is certainly a wonderful one-stop shop. That assumes, however, that the person that you're talking to has a belief that the government is benevolent and has the right information and is sharing good information. I think if you fall into that camp, and most people do, the CDC site is perfect for you. If there are other concerns, or if you have really deeply entrenched nervousness about government, there are other organizational sites that are really good for you. Find an organization that you look up to, that you trust. If it's a medical one, that would be ideal. If it's a community-based one that's getting information, look for those credible sources that are from people that you trust. The question, I think, then becomes, are the people that you trust the right people? But getting into some of these conspiracy theories can be a really daunting conversation, because there are so many pieces to them. And so I think as we're addressing hesitancy, what we as a vaccine advocacy community need to focus on is, do people trust the vaccine itself? So let's do education about what the vaccine is and what it is not. Do we trust the person who's giving the vaccine? And so a lot of times we push back to those trusted providers to say, have those conversations with the person in front of you. And do they have the resources that they need to have these conversations? And then thirdly, do you trust the process? And so that was what I was talking about before, about being really pleasantly surprised with how many people are engaged with this right now. But if you can sort of separate out where people's issues are, the vaccine, the person that's giving it, the process of developing it, you can really more effectively address where some of those questions are coming in, and direct people to the right kind of information that will effectively address their concerns.
That's super interesting. Thank you. That was very, very helpful, Elizabeth. Thank you.
Let me just say that maybe I'm a pessimist, but people that believe, I think you need to distinguish anti-vaxxers, people that are looking at things that are not science. You're not going to turn them around by showing them science. It's like water and oil. I think you're going to be wasting your time trying to convince somebody and demystify that. I think that's very different than talking about people who have hesitancy, who are doubtful, who have concerns. And as it was mentioned in the minority communities, a lot of it has to do with mistrust of the system. A lot of it has to do with years of abuse. I think we need to not put everybody who has doubts and concerns into one bucket and really separate. And there's a group that no matter what you do, you're not going to convince. So rather than wasting your time there, I think you need to go to work with, like Leon and others are doing. You work with the people that actually have questions. And I tell you, there's one word here, and it's called trust. And getting people to trust you sometimes just means you sit, you wait, you listen. And my priority may be to get you vaccinated. Your priority may be just to talk to me and to show your concerns. And it may require 2 or 3 visits before you finally agree to a vaccine. And that's okay. So trust takes time. And I think we need to be careful not to force people into something. We need to really develop a partnership. And as you develop a partnership, then the trust changes. And once there's trust, then the entire community changes. So I think it's not a process, here's the information, look it up in the web and come back and get your vaccine. It really requires time. It really requires, trusted sources, and it requires patience. And I think we need to just be really careful and not try to rush this process.
It's interesting you say that. I interviewed Dr. Besser just last night on my program, and he said exactly the same thing, that over the years, he's a pediatrician. He said he'd have patients come to him and say, I don't want my child vaccinated. And he'd say, well, just find another pediatrician. And then actually what he's realized is that listening is the most important thing he can do to try to persuade the parents of his patients to get their kids vaccinated. A lot of it is about listening. We have about 10 minutes left, slightly under, and there are quite a lot of questions that are very specific medical questions about the vaccine, and I want to raise them because I think they will help get to this idea of safety and trust in the vaccine. Let's start with Scott, who has sent in this video from the Liver Coalition of San Diego.
Hi, my name is Scott Succo with the Liver Coalition of San Diego from California. My question is for those living with a liver disease, whether it be an autoimmune disease like autoimmune hepatitis, or if you've had a liver transplant and are on autoimmune suppressants, how might being vaccinated impact you, and what would you tell patients with a liver disease?
Does anyone have any information on that?
You know, again, I would tell you as a clinical trialist, a lot of the people we enroll in clinical trials had, those that would have excluded somebody from participating in a clinical trial. And therefore, a lot of the people that the questions that are coming right now is, how about this patient that has liver disease? How about this patient that is receiving chemotherapy? How about this person that is on, TNF alpha inhibitor? All those individuals would have been excluded from a clinical trial, so we don't have information. But we will when we start vaccinating. We will when we do what we call phase 4 studies, which is exactly looking at, at what happens at the community level and once you start rolling out a process. And that's why the research doesn't stop with the phase 3. You really move into this phase 4 because research in phase 3 is about efficacy. Research in phase 4 is about effectiveness. We want to see the effectiveness. So a lot of times right now we have to tell people we don't know. But after a conversation with an individual, I may say, but it's in your best interest to get vaccinated right now because of the following things. I can tell you, for example, HIV individuals are saying, well, what about HIV? Patients of mine living with HIV, I say, look, your HIV is controlled, you're on antiretroviral therapy, you're doing fine. You will be fine enrolling. But if I have somebody with newly diagnosed HIV on a CD4 count of 5, who has capsular sarcoma, I may say, no, let's get your immune system up and running, and then we'll vaccinate you. So every individual is going to be different. And that's why we as healthcare providers have to really look at every situation and decide what's best for the patient in that situation.
Okay, another question. We're doing a kind of lightning round here. How do I know if it's safe for my kids? Jewel, do you want to take that one?
We're all going to be learning more about that since the youngest children were not included in the trials. I think in most circumstances, it was adolescents 16 and up, maybe some more, but we're going to be learning that quickly as we go along. And those will be the ongoing conversations with your pediatrician as we get into these next phases.
When might the vaccine be approved for pregnant and nursing mothers and their children? Susan, do you want to take that?
So I think similarly, we're learning more. And so as we learn more, then we'll know more about the populations where it would be appropriate and advisable. So that it's back to that conversation of what's my situation and what's the decision that I should make based on my health and the recommendations for the vaccine. So these are conversations that we need to be having with healthcare professionals.
And just to clarify, at the moment, are pregnant and nursing mothers on the list to receive the vaccine, or are they not at the moment on the list? What's the advice to pregnant women?
I believe the CDC recommendation is that pregnant and nursing women should be offered the vaccine. They haven't studied the clinical trials excluded nursing and pregnant women, but the CDC recommendation is that if they are comfortable and wish to receive it, that it should be offered.
There's another question here from Mike in Milwaukee. The only question I have at this time is this: does the Moderna vaccine require 2 injections like the Pfizer one does, or is 1 shot in the arm enough to get immunity from the virus? Carlos, do you want to take that?
No, you need 2 shots. Both mRNA vaccines need 2 shots. The AstraZeneca vaccine needs 2 shots. The only one out there who is in the process of clinical trials in phase 3 and moving along is the J&J vaccine, and that's only one shot. So a lot of us are hoping that the J&J works well because we're implementing a 2-shot vaccine is a challenge. But at this point in time, it's a 2-shot vaccine. Having said that, the data is very encouraging that after 1 shot, you get a lot of protection, but we don't know how long that protection lasts. So I would encourage anybody, if they get the first shot, to come back and get their second one.
Can I just ask you one final question, because I think this one is important? And Elizabeth, maybe you could just answer it correctly, because I'm not sure we know this yet. Will I need to get vaccinated every year?
We don't know yet. I think the bottom line is that what we're seeing is very encouraging in terms of the longevity of the vaccine. I think what we've seen coming out about natural levels of immunity, if you've had COVID, are encouraging. Most people are not getting reinfected, and you see that high presence of protection for as long as we've been able to study COVID-19 thus far. But we don't know. The signs are positive that we won't need revaccination and that natural levels of immunity will last, but that's something that we're going to have to continue to study into the future. So still a lot still to learn, but I hope that we have managed to clarify during the course of this discussion some of your questions, some of your concerns, and to set the record straight on what we know and what we don't know. And thank you all for being so honest about what we don't know, because I think actually that is a very important part of building the trust. When we can say honestly, we don't know yet, for example, the impact on liver disease, I think that helps people realize that when we do say something, they can trust what we do know. Elizabeth Subcheck, Jewel Mullen, Susan Winkler, Leon McDougall, Carlos Del Rio, thank you very much for joining this discussion. For more information, do stay tuned to Partnership for Infectious Disease and Vaccination by visiting www.fightinfectiousdisease.org. Vaccines and information go hand in hand. So let's continue to ask those questions and share knowledge with one another. Until next time, stay safe, stay healthy, and let's work together to put an end to this pandemic.